Mental health is a topic that people have been reluctant to discuss for a long time. As we continue to break down the stigma surrounding mental health, we are seeing more and more people reach out and ask for assistance with their mental health, which is the first step to getting the help they need. The Forestry Safety Association of Newfoundland and Labrador, with the assistance of two Bachelor of Science in Nursing students, Shannon Ivy and Victoria Blake, who are completing their community health clinical placement, have conducted a needs assessment survey of the forest industry. As a result of this survey, mental health education was a need that was clearly identified by the forest industry. Please take a few moments to listen to the following presentation for some important information on mental health.
Mental health is a topic that must be taken seriously as it disrupts lives, causes stress at work, and costs the Canadian government. A large percentage of Canadians report that mental health causes a disruption in their lives, and consequently 47% of working Canadians say that stress is experienced at work. Overall, as a result, depression and anxiety alone cost the Canadian economy $49.6 billion per year. So it is important to create public awareness to be proactive and not reactive to lower these costs. So here's an overview of what we'll be discussing today. So today we're going to provide you with the why, what, and how. So under why, we're going to discuss how does this information pertain to you. What, we're going to talk about what is mental health, and how do you achieve mental wellness at work and in your everyday life. So the why. So we're going to discuss our needs assessment next. So we completed a needs assessment on your agency to determine the health needs of its employees to conclude a key barrier to health that is experienced by yourself and strategies we can implement to reduce the barrier. This needs assessment was conducted using an online survey which was distributed to management who then distributed to all fellow employees of your agency. Through this tool, we asked questions pertaining to demographics such as age, gender, and your place of work, mental and physical health, which were presented to you through a series of rating questions and short answers.
The needs assessment of the agency revealed that majority of employees are of male gender and 40% of employees are above the age of 50. People over the age of 50 are at higher risk for experiencing depression and anxiety, and males are more likely to experience depression without reporting it and have higher rates of death by suicide. A mental health initiative is also important for the people of the forestry industry because they are 2.5 times more likely to experience some form of trauma while at work, which correlates to increased risk of mental trauma as well.
The following paragraph depicts ratings of perceived health, supports, education and training, and safety for managers. In our data collection survey, we ask questions such as how would you rate your physical health, how would you rate your mental health, what are your supports both physically and mentally, and other questions related to the education and training received physically compared to mentally, as well as employees' comfort level confiding in managers with issues with their physical health compared to their mental health. The following data shows how many respondents rated responses to the following topics at a 4 or 5. As you can see, the barrier to mental wellness within the workplace is much larger than barriers to physical wellness. From these results, we were able to determine that mental health was something that your agency can build on, and throughout this presentation, we will discuss how mental health wellness can be achieved through resources and appropriate methods.
In this section, we will discuss the what of this presentation. This section, we will discuss what is the difference between mental health and mental wellness, giving you a better picture of what mental health is and how you can obtain wellness. The best way to understand mental health and how it differs from mental well-being and illness is to picture it as an umbrella. Mental health is a universal term, with mental well-being and mental illness as subcategories within mental health. It is also important to note that mental well-being and mental illness are on a scale of continuum. It is not as simple as saying as someone has a good mental health or a bad mental health. It is the same idea as your physical health. Health is the big picture. Someone can be considered very sick or very healthy, but we all fall into a place in between the two. Just to further explain what the differences are, as you can see from this diagram, mental health is the overall idea of health for our mental state. As previously mentioned, it is the same idea as talking about our physical health. It affects all aspects of our life. If we have mental wellness, our mental health will impact our life in a positive way. But if we have maladaptive coping mechanisms, are surrounded by negative influences, and think badly of ourselves, we will have poor mental health that could even lead to mental illness, which will have an overall negative effect on our life.
You may be experiencing stress without even realizing it. Here are some signs of stress that you may be experiencing. So signs of stress include perspiration or sweating, leg trembling or hand trembling, increase or decrease appetite, skin itching, sleep disturbance, so maybe too much or too little, rapid heart rate, breathing difficulties, and even pain. Stress can affect most body systems, which in turn has the potential to negatively affect physical and mental health. Stress can elicit effects on the brain, causing difficulty concentrating, anxiety, depression, irritability, and brain fog. As well, can have effects on the heart, so including high cholesterol, high blood pressure, increased risk of heart attack, and stroke. It can also affect different systems in your body, such as your joint and muscles, immune system, skin, gut, and reproductive system.
How can your mental health be improved in the workplace? There are different types of stressors at work, but two we will be diving further into are how to decrease stress when working at night and coping strategies that you can practice at any time of the day. After speaking with multiple people, one common time when people feel the most anxious is when they are working at night. Although we can't take away your night shifts, we can provide you with strategies to help decrease stress and the risk of having too much anxiety when working at night. The first tip we had for you is to be well rested. Studies show that having adequate sleep of at least 8 hours a night will decrease anxiety. Bring a change of clothes. Having a change of clothes in case you get wet or cold will decrease stress and anxiety. Tell someone your plan for the day. Telling someone your plan for the day, such as your estimated time of arrival home and where you will be during the day, will decrease any amount of stress that someone has, especially if you are lost and are later than expected to get home. Bring extra food. You may be caught in the woods for longer than expected. Adequate food and water supply is crucial. Bring a flashlight. It always helps to have lights and to see where you are going at night. This will also decrease the risk of injury and falls. Although people have said that they feel anxious when working at night, we can have what we call bad nerves at any time of the day. Relaxation practices can be done at any time of day, at work or at home, by yourself or with others. Relaxation practices do not need to be complex. They can be anything you enjoy, from listening to music, to saying a prayer, going for a walk, or even just driving around town. One relaxation practice that can be added to your list is called 5-finger breathing, and Victoria will now explain it to you.
Next, we will discuss 5-finger breathing. This is a great tool to use as a coping mechanism to decrease stress. This tool can be used in the workplace, in the comfort of your own home, or anywhere you may be. So open your hand and show your palm. Straighten your back while sitting or standing comfortably. You will use your pointer finger from your other hand to trace each finger while breathing in and out. So for example, take your thumb and trace your finger up your thumb, and while doing this you will breathe in. As you trace down the other side of your thumb, you will breathe out. We will now give you some time to repeat this with the following 4 fingers. Here are some self-care activities you can do today. Self-care is important as it decreases stress and improves mental health. These activities are for both men and women. So these activities include, but are not limited to, getting some exercise. Exercise just 30 minutes a day of walking every day can help boost your mood and improve your health. Small amounts of exercise add up, so don't be discouraged if you can't do 30 minutes at one time. Eat healthy, regular meals, and stay hydrated. A balanced diet and plenty of water can improve your energy and focus throughout the day. Also, limit caffeinated beverages such as soft drinks or coffee. Make sleep a priority, stick to a schedule, and make sure you're getting enough sleep. Blue light from devices and screens can make it harder to fall asleep, so reduce blue light exposure from your phone or computer before bedtime. Try a relaxing activity. Practice meditation. Explore relaxation or wellness programs or apps which may incorporate meditation, muscle relaxation, or breathing exercises. Schedule regular times for these and other healthy activities you enjoy, such as journaling. Set goals and priorities, or me time. Decide what must get done now and what can wait. Learn to say no to new tasks if you start to feel like you're taking on too much. Try to be mindful of what you have accomplished at the end of the day and what you have been unable to do. Practice gratitude. Remind yourself daily of things you are grateful for. Be specific. Write them down at night or replay them in your mind. Focus on positivity. Identify and challenge your negative and unhelpful thoughts.
All mental health concerns can be spoken with a medical provider at any walk-in clinic, through 811, or with a family physician. In the case of an emergency, please contact emergency services or call 911. Thank you all for listening to our presentation and learning more about mental health and strategies to decrease stress in your lives. We hope you enjoyed. Take care.